The International Diabetes Federation says over 539 million people around the globe are living with diabetes, a metabolic disease characterized by elevated blood sugar level, and more than 6.7 million people have died as a result of the disease. Diabetes is said to be the major cause of blindness, kidney failure, heart attacks, stroke, and lower limb amputation, and it's forecast to become one of the leading causes of death in Africa by 2030. To this end, November 14 every year is set aside to commemorate World Diabetes Day to raise awareness about its prevention and management. This year's theme, Access to Diabetes Care, highlights the importance of having equal access to the right information and essential care to ensure timely treatment and management. The chairman, Diabetes Association of Nigeria, Ondo State Chapter, Dr. Adenike Enikuomen, highlights unhealthy dietary habits, aging, obesity, physical inactivity, family history, among others, as causes of diabetes in Nigeria.
Diabetes is a chronic disease and it's also a metabolic disease. Anything that you say metabolism means that the way in which the body handles its food we eat for energy and growth. And it's due to insulin deficiency, or the insulin is not there at all, or even when it is there, it is not functioning properly, even when it is in excess. This leads to elevated blood glucose, and this elevated blood glucose leads to abnormality of carbohydrates, protein, and fat. And this can lead to multiple organ damage in the body. If you look at the world, you can see that the whole world is filled up. And majority of the people here, they have diabetes, either the complication of diabetes or they are coming because of diabetes emergency. So what do you need to actually know about diabetes? The risk factor for diabetes is, as we are increasing in age, diabetes occur. If you have family history of diabetes, one could also have diabetes. If you have history of hypertension, physical inactivity, obesity, use of drug that can result in diabetes can also cause diabetes. Use of some pesticide.
Dr. Enikuomen said many are not in the know of the dangers of late detection of diabetes, hence the need for intensive advocacy and a healthy lifestyle.
When you are passing urine frequently, then you can say that you have diabetes. And then when somebody is thirsty, excessive thirst, or somebody is losing weight, those are for people that are lucky. Majority of the people don't even know that they have diabetes. They don't know. So they come with complication. It's either when they don't feel okay, and then they now come at the end of the day with complication. Mostly they can come with eye complication, crawling sensation, stroke. Some come with stroke. Some come with heart attack. Some come with the fact that they cannot go to toilet. They are having constipation. This is a disease that if it is well managed, you can stay up to 90 years, 95 years. Even some people stay up to 100 years. By the time that we are getting to the age of 30, we need to actually screen for diabetes. So that we know that we have diabetes, we need to screen. It's not just fasting blood glucose, we need to do 2 hours postpartum. So we now say, know your risk. Do you have family history of diabetes? And apart from that, healthy eating. When you know your risk, you know that I'm risky, I could have diabetes because I'm growing old, then you check. Going to the right person. The response is, where do you go? Some of our people, they don't come to the hospital. I can't come to the hospital. In that hospital, I will waste my time. What do you need to do? Exercise is very important. Increased physical activity is very important. Healthy eating. Some people have demonized our local food. Our local food is not as bad as you think. When you come, what you need to pray for? Let me see the right doctor. And when you are going to the hospital, you know that day, I want to use it in the hospital. And then at the end of the day, you make sure that you are seeing the right person.
It is believed that with deliberate steps taken by the general public, diabetes would be brought to its barest minimum, thereby reducing its mortality rate. Joy Pius, OSRC News.